653, 1320 WILS. So it's the holiday time, but, when you're running around buying presents and picking them up and down and all around, you can end up hurting your back in some very serious ways. We're joined by Dr. Pablo Zeballos. He is an expert on pain management. Dr. Zeballos, great to have you on WILS.
Thank you so much for having me on your show.
Do I have it right, Zeballos or Zeballos? Which one is it?
My patients call me Dr. Zeballos or Dr. Z. They all call me Dr. Z.
Yeah, Dr. Z. Dr. Z is a great way to put it. Hey, tell me this. So you deal with a lot of folks with back pain. How does it happen? Is it a gradual thing, or do they just have one moment where suddenly they did something and it hurts?
It varies, obviously. We have some patients, usually the younger patients are the ones that develop the acute pain. These are the ones that have, they twist their back, they try to lift up all the Christmas boxes, coming from the attic, and that's usually what you can see that. And that's more of a disc. The disc is like the little soft cushion in your back. Now, if you're older, you develop more of a progressive pain, and that's more of the arthritis. So it varies.
So when you do something to the disc in your back, what do you typically do to correct that?
To correct that, about 80% of back pain will heal by itself without doing anything after 2 weeks. So within 2 weeks, 80% of you just taking it easy, just relaxing, stretching it, and resting it will be fine. If not, then manipulation, some manual medicine, some anti-inflammatories would help. And if not, then that's when I go in there and I put some medications into the spine to help alleviate that disc
So
pain.
What is it? The disc actually moved out of place? Is that what occurs? Or?
So the disc will end up causing some inflammation. The disc is nice and tight, and it's kind of enclosed. And when you do certain movements and certain pressure on it, it can actually have like a little weakness of the disc. And the weakness of the disc can actually end up causing like a tear. A tear would be, imagine like a paper cut in your disc. And that can cause significant amount of pain.
Okay, so you say 80% heal on their own terms, and what, the back just returns to a healthy, normal state, or?
Yeah, it can do that. That's if you do the proper treatments, which is, proper exercise, proper core strengthening, if you make sure you minimize any junk food, those are all the things that you want to make sure if you're going to go back to your
how does junk food affect your back?
Very, very, very easy. So the more junk food you eat, the more weight you put, the more pressure on the disc. The more pressure on the disc, the more chance of you having a disc herniation.
Is this the obesity you're saying, just the weight itself? Is that it?
It's exactly correct.
Now, I'm curious because I just saw there's this new documentary out about this guy named Dr. Sarno. A lot of celebrities know this guy. He's famous for a book like Healing Back Pain. His whole thing is that most back issues are really mental. It's an issue with your mind and your emotions. Do you agree with his whole philosophy? Or?
I think there's some truth to it, but it's not everything. So that's the problem with these books that sometimes they come out. There's some truth and validity to it, but then you cannot just generalize everything. You cannot say everything's mind over the body. When you have an acute inflammation of the disc, I don't care if you meditate, I don't care if you keep your mind clear, it's not going to, help heal it. Now, if you have chronic pain chronic pain is anything over 3 or 6 months, then yes, you start using meditation, using mind, that can definitely help out.
And I need to point this out because what he said that he looked at all these back scans for all these years, and he found no correlation between what he actually saw versus the pain the patients were reporting, that he'd see backs that looked like the person should be in pain and they had no pain whatsoever. Have you seen the same thing too? Or?
Yeah, so this is one thing I tell all my patients, and I tell my residents that rotate through my clinic. I tell them, in order for the MRIs, they have to correlate with the clinical exam and the patient's, the way they describe their symptoms. So you're correct. I cannot just grab somebody's scan and based on that make a diagnosis. So I actually have to put my hands, have to basically test them, do an examination. If their examination with their complaints fit the MRI, then you're correct. I do treat it. But
so how do you make sense of that? When you look at an MRI where it looks like there should be a major problem and the patient doesn't seem to have one, how does that make sense?
Yeah, so it's not that we end up doing what's diagnostic testing. We end up doing different diagnostic blocks, diagnostic injections. So there's ways of figuring out, is the pain coming from the disc, is it coming from the joint, is it coming from the muscle, or is it basically in the mind too, could they have something like fibromyalgia? So there are many, many, many factors that we have to take into place. And so those books sometimes put it too generalized, make it too simple, and that's not how it is.
If you've had back pain for years, this has been part of your daily life, how likely are you able to make that go away in some form?
I think the way I tell patients is if you have chronic pain, it's difficult to make it go away and cure and fix. The way I tell patients is if you have chronic pain, the goal is to minimize the pain and improve your function and quality of life. If you have that mind frame, then you'll be successful. We're all going to have some sort of pain in our life, so if you're able to address it and keep it down, that's going to be successful.
Now, when you see chronic pain that's not based on any severe injury that's occurred, what's really happening there?
It's just degeneration, wear and tear. After a while, your body can develop, like bone spurs that can irritate the area where the nerves come out. You can have, obviously, the discs that are nice and cushioned get more dried out. And so over time, that degeneration, kind of like, when you feel your joints crack and popping as we all age and you feel it starting to wear and tear the pain, that can happen in the spine and the neck and the low back. All that is chronic pain. And you're correct. With the chronic pain, exercising is huge, dietary is huge, but also mind is, doing the meditation, doing the mind over body is huge too. I agree with that.
One last thing, 30 seconds here, but if you're advising somebody who's got to carry heavy things this holiday season, what would you say to them?
I would say please minimize the amount of heavy, obviously you put in your bag. And if you do have to carry heavy objects, carry it across your chest, not in one arm, but across your chest. Or try to carry like a backpack, something that can give you great support in the spine. That way you're not sitting there slunched over one side over the other.
It's Dr. Pablo Zeballos, expert in pain management, Dr. Z, right here on 1320 WILS. Thank you very much.
Thank you so much for having me on your show.
And that is it for us. Michael Cohen, producer Mike Peterson. It is Friday, 1320 WILS. We'll be back on Monday. Please join us then. Have a good night. Bye-bye.